Welcome everyone. We'll just wait a few minutes for more people to get here. Okay, I think we will start as we do have a little bit to get through. Welcome everyone to our climate and gender panel discussion organised by Students for Global Health. So this webinar is the third part in a 4-part series running every Thursday on climate justice. We will be recording the session, so please bear this in mind if you're conscious that you've got your camera on, but if you feel comfortable enough, please do turn it on. And we will have time at the end for questions from the audience, so please send these in the chat. So I'm Veronica, I'm a 5th year medical student currently intercalating, and I'm currently the communications lead for the coordinated theme of climate and health at Students for Global Health. And we have 3 very inspiring speakers today. They will all introduce themselves now. So without further ado, we have Dr. Nicole de Paula, Kim van Daalen and Laura Jung, and over to them. Nicole?
Hi everyone, good to see so many inspiring people willing to make a change here. So yes, I'm Nicole de Paula, I'm from Brazil, based in Germany, and it's a pleasure to share this panel with Laura and Kim, great colleagues, very interested in this issue of climate and gender and planetary health. So I will share my screen. Let me know if something happens here. Let me just change the view here. I'll try to share my screen. And let me know if something happens. Can you see it? All good?
That's perfect.
Good. All right, so maybe I'll just try to put it here. All right, so today I think the conversation is really about women empowerment, and I want to make a point about planetary health, which is, I think it's even more systemic than climate change. I like to start saying that today is really one of the best days to be alive, right? That's a narrative. It's hard to believe in such a difficult times because of this pandemic, but we have so many data showing major achievements in public health, as you know, better than me. I'm a political scientist. Actually, my expertise is in international relations. So I learned a lot working with medical doctors. But we have life expectancy that improved, poverty reduction, child mortality. But also we are here because seems to be is the worst day to be alive. And it's really because of this, what we call the Anthropocene, right? This massive footprint that we are going to have, we're having, and the impact on our planet. Here, this photo of what we're doing to our oceans, and all this trash that we're putting out there is really coming back to us and affecting our health. And we see the point is really, we don't need to look in detail to these graphs, but whatever it is, we have overexploited, right? What is out there. We're talking about deforestation, ocean acidification, use of energy, of course, not the green and renewable ones that we would like to see, but fossil fuels and fertilizers, so many examples, especially since the 50s and after the wars. But of course, if you think about the worst day to be alive, I think when you put yourself in the shoes of women these days, it's very hard to understand how difficult it is to live through a pandemic, through a lockdown, when you have this massive disease around the world. So prior to the pandemic, I just want to highlight this issue of domestic violence because it's so symbolic that with all the crises that we're having, it's already so difficult. But if you imagine This 40% of increase of human violence around the world, and it's not only a problem of developing countries, for example, everywhere we saw this increase. And I like to see this, we found this a problem of domestic violence was already happening, was, 1 in 3 women saying here they were experiencing that. And already at that point, we have a massive cost and economic cost of this type of problem that we are now seeing is worse. So COVID-19 affects women so disproportionately. And there are 4 major points. I think we're going to have a conversation about this, but I just wanted to highlight that, of course, the majority of health and care workers are female. And we're going to see some numbers soon. They are out there caring for ourselves, even if it's at the hospitals or at home, and often, of course, not being enough compensated for that. So the double at homes, those who are not in the front lines, we have this double burden of care, right? And if you're at home women also have a very busy life with kids and trying to do all at the same time. We have the problem of informal jobs usually taken by women as well, and they're the first one to being dismissed. And of course, the problem of violence. So this is just a very quick illustration of the amount of women who are in this care workforce that really gives us a sense of how they are first suffering the burden of this pandemic. So we see 3 main problems, right? Women, they still fail to secure these leadership positions, to also put their concerns and priorities out there. And especially in the global South, there's something that is very important that I would like to highlight here. We talk a lot about the UN Sustainable Development Goals. That of course includes climate, but we are not on track to achieve any of these SDGs actually. And if you see specifically on the environmental dimension and gender, now we're going to see a lot of setbacks because of this pandemic. So I believe that gender equality is one of the key solutions, but it's still underrepresented. It could be in the climate sphere, in the planetary health sphere, but it's just such a way that we could see a cost-effective, simple solution to so many of the problems that we like to address. So the way forward is really showing to me is this linkage between what we call planetary health, right? It's gender equality, sustainability, human health, they're all connected. And we need to train more and more women to be acting as leaders in the areas that we need the most in this, what we call the global South. I really enjoyed this narrative and this framework that we call planetary health that was gained a lot of force with this new, with this commission from the Rockefeller Foundation and the Lancet launched in 2015. And just a quick definition here says planetary health is really this health of human civilization and the state of the natural systems on which it depends. There is no healthy people in a sick planet. And there are so many elements that are connected to this. And climate, of course, is just an accelerator of all this crisis. We're seeing now eco-anxiety with the problem of food and malnutrition, but at the same time, it's undernutrition, obesity, infectious diseases, the zoonotic diseases, these pathogens being transmitted from animals to humans like COVID-19. And of course, we have a world with our fighting for these resources. We're going to have even bigger problems of security. So I think planetary health is really about bringing peace to the world. I don't have the time to expand all this conversation, but I would like to invite you to consult this. We just wrote this policy brief with Katie Marr, a colleague of mine. I work also for the IASS, the Institute for Advanced Sustainability Studies, and I'm also the founder of Women Leaders for Planetary Health. So together we really discussed this connections between health and climate. So I like to see that planetary health is a vision, but it's a vision to multi-solve. We really don't have the luxury to tackle one problem at a time. If you get your favorite SDG here, we really to work in this holistic perspective. So it's a very nice narrative that I would invite you to use more and research and discuss. I see COVID-19 as, it's of course, a lot of it's very challenging, but I think it gives us a great opportunity for changing, and I am already seeing this on the field. So I would also like to invite you to connect. If you haven't seen that yet, I'm on the steering committee of this campaign, She Changes Climate, and it was really to see that despite all the conversation and the advancements we were seeing at the beginning when the UK presidency for COP26 was starting to gain shape, we saw that the gender balance was really unbalanced there. So there was this launch of campaign that got really big, and more than 400 important names signed to this. So you can get a lot of information in this website. That is really a call to action here. So I would love to continue this conversation. We have here also our contacts, and happy to have a dialogue during this event. Thank you again for the invitation.
Great.
Thank you.
Thank you, Nicole. Next, we have Kim.
I just need to stop sharing my screen.
No problem.
1 second. You're still seeing mine, right?
Yes.
Yeah.
Great, because my Zoom is not showing anything now. That's the first one.
Do you think one of the co-hosts can disable yours?
Yeah.
Let me see. Oh, I stopped your video. Oh, I stopped your shares.
Now it's fine. Now it's fine.
Okay, then I will start with sharing mine. So I have a slightly different presentation than Nicole has. Nicole, thank you so much for that great introduction into planetary health. And the organizers asked us to speak a bit about what we are doing and what we are working on in environmental health and things in regard to gender. So I thought it was interesting to share a bit of what I'm doing in my daily lives. And hopefully that's particularly interest for the students as well. So I work a bit on 3 different things at the same time. Part of me is focusing on environmental pollution and specifically on cardiovascular disease. And that is what I'm doing with my PhD. Part is more focusing on climate change and health. And part of me is more working on gender issues. And that is something that I do with the NGO Women in Global Health. So actually I started out as a biomedical science student and then moved into environmental epidemiology because I was part of a lot of these climate movements and realized that I wanted to make from something that I was passionate about, something what I wanted to research as well. So next to my PhD, I'm also working for the Landslide Countdown, and many of you may know this already. This is an academic collaboration of over 120 leading experts around the world that monitor the interaction between climate change and health. And every year, these findings are being published in an academic report from the Landslide. And these are accompanied by all kinds of policy briefs. So for example, a policy brief to the European Union, but also for example, Germany and America. And these are really focused on the bigger emitters of carbon emissions around the world. And this is then published around the UN climate negotiations with a goal that the evidence will influence policy in a positive way. And next to that, I'm involved in a lot of other climate change and health research and working on a book on climate change and global health. But I also work a lot on women's health and gender equality with the NGO Women in Global Health. So Women in Global Health is specifically focusing on enhancing gender equality in COVID-19 in global health leadership. So we recently were focusing on COVID-19 decision making, for example, but together with Laura, we have also started to focus more on climate change and gender-based health disparities. So all of my work at this moment is a bit intersecting between inequalities in general, gender, climate change, as well as environmental pollution. And this actually started as a younger student, where I started out in more the activism space. So I was organizing climate marches, and at the same time I was involved in a lot of gender equality movements, and together that brought it a bit together, and that made me do the research that I'm currently doing. And I think that is the same for a lot of other students here as well, and a lot of other researchers in this movement, that we identify as both researchers and activists at the same time. And I think that is a really interesting dynamic to be in, and in a position we should make use of as well, to use the research that we're doing to activate change. That being said, I did want to mention a few things of why I'm so passionate about climate change and health specifically, and why specifically so much about inequalities and gender inequalities. Because like Nicole already said, although human health has always been intimately connected with our environment and with the climate change is now happening more rapidly and dramatically before. And we see that in almost every aspect of health as well. We see that people are being exposed to heat waves, to extreme weather events, and this really results in this multi-hit scenario of different health impacts. And this is really what is the worrying bit, because it is not just air pollution that we're worried about or just heat waves, but it's really this multifaceted of different things that are impacting the humans' populations across the world. Everyone is in the world is impacted. And that leaves our infrastructure and public health infrastructure unprepared if we're not able to bring the proper mitigation and adaptation strategies in place. But what is really important to take in mind here is that the most vulnerable and marginalized populations are feeling these health harms the most acutely. And like COVID-19, climate change reveals deeper questions of justice, whereby climate change is interacting with existing social and economic inequalities. And that is something that we will be discussing here a lot more as well. So when we talk about multidimensional inequality in general, we see that that leads to greater exposures to climate hazards, greater susceptibility to damages to climate hazards, and less ability to cope and recover from damages caused by climate hazards. And it is, of course, something that we see for gender as well. And this again leads to disproportionate impacts on income and a vicious cycle of inequalities that gets exacerbated because of climate change. And my own interest is then specifically in gendered inequalities as well. So we know that all genders differ in their needs, perception, and attitudes, and that may influence how they respond to climate change. And we will go in a bit more detail about this in the following section and in the questions. So we'll not talk too much about this, but I do think that there are really big gaps in leadership that we see in the international climate negotiations as well. So Laura and I worked together on a paper as well that is currently being considered for submission, and she will talk a bit more about that. But these issues are very important because if you don't have women and marginalized people that are able to share their voice and to share their concerns and to share, and nothing is going to be done about those, and we end up with adaptation and mitigation policies that are exacerbating inequalities instead of that we are addressing them. And I think with that, I want to end and talk about this further in the question section.
That's so great. Thank you so much, Kim. Laura?
Yes. Hi, everyone. I'm gonna take it even to I think a bit more personal level than Kim did, because I am also a medical student, medical intern at that point. So I think for a lot of you, it's going to be really interesting on how, especially medical students can, or students in general, can engage in that topic. So for me, how it started is that I had a pretty long-standing interest actually in environmental determinants of health. However, it wasn't really climate change in the beginning. It was, the environment that is probably closest to most of us. It was urban environments and urban health. And I then, in the middle of med school, I moved to London to do a master's in public health, which essentially was for me a turning point that opened my eyes to basically be able to put urban health into this bigger picture of environmental health and also including climate change. And that's really what fueled my interest and my activism for climate change and health. I then worked with the German Medical Students Association as well with the IFMSA on climate change and health. I prepared a lot of policy briefs on that topic, a lot of guidelines, manuals, all those things that I guess a lot of you know how those things work. And I started advocating for climate change and health also on an international level. And I'm now going to also share my screen. And you should be able to see it now.
Yes, we see it.
Okay, great. So I started advocating for climate change and health internationally, and there it mainly was really for the inclusion of health in international processes, in UNFCCC processes, and so on. And that's also where I first met the gender and climate movement, because I actually was part of a gender delegation. That's the spot that I got to go to a climate meeting. And it was by chance in the first place, but I also learned so much, and I got to know the climate and gender movement. And I also learned that they are not very much caring about health at all. It was just not on their list of arguments, and they had a completely different focus that I had at that moment. So those were my first experiences in international climate change negotiations, and I took that back. And then what we actually did is I went back from the international stage, if you want, to a more local advocacy and activism, because we founded a Health for Future movement in Germany, which is pretty similar to Fridays for Future, which you might know, but with a focus on health and healthcare professionals. And we really took that to the streets in times where this was still possible. Seems a bit crazy right now to look at those pictures with all those people without masks. But then we really took the movement to the street, tried to involve as many healthcare professionals as possible to talk about climate change, and also planetary health that was really just coming up at that moment in time. But I also had this interest in other inequalities, namely gender inequalities, probably also because I'm a woman myself. So it's something very close to my heart, but also just because knowing, and most of you will know that gender is such a big determinant of health and has such a big impact on our everyday lives. So then I started working very closely with women in global health, as Kim mentioned, and also started working on, first of all, research disparities, so the lack of gender disaggregated data in climate change, and then what Kim said on gender, or female leadership in climate change and in climate change negotiations. So coming a bit back to where I started when I went to the climate negotiations with the climate and gender constituency. And I think there will be more on that following as well. Our paper is not out yet, but we will keep you updated. And then recently I joined, it's already more than a year now as well, I also joined Women Leaders for Planetary Health, because there I really saw an organization building that were making those links between health and gender and climate and our future, actually, because that's what it is. So I joined Women Leaders for Planetary Health, and I think Nicole already said, and is probably going to take us a bit more into that later on. But just saying it so much that it's an organization that really focuses on lifting female voices in the climate and health spectrum. And I think that is something that we very much need, which also showed the research that Kim and me were performing. And then recently I was part of another very exciting project that I really want to share with you, and that is I supported the setting up of the Planetary Health Eastern African Hub, which is a hub actually led by a young woman from Kenya that is bringing the whole planetary health topic to the Eastern African region. And for me, that was so exciting to work with young women from other continents, from other regions, and really helping to have a knowledge transfer, to have a skills transfer, and to trying to set it up. And it's a very inspiring work, and I encourage all of you to check out this initiative. There is also some videos on YouTube, and it just really broadens the view. I think that's something that Nicole also said before, because there is not only female voices missing in the discussion, there's also non-Western voices missing in the discussion, and this hub really tries to bring that also together. So very exciting project. It's very new and just growing. And yeah, and with that, I think I give it back to the organizers.
Great. Thanks so much all for that introduction. Obviously, there's a lot of issues that need to be considered within this topic. And just to open up the discussion a little bit more, and with all the expertise that you have and the experience, would any of you be able to comment on how the impact of climate change on gender inequalities varies across different demographics?
Yes, sure. I can have a go at that. Before we start with discussing that, I think it's helpful to establish what we actually mean with gender, because in the women and gender constituency under the UNFCCC, a lot of the time is actually spent on talking about what we mean with applying a gender lens and what we mean with gender as a social construct. And here I think it's important that we realize indeed that gender is this social construct that intersects with other systems of oppression like ethnicity, race, sexual orientation, economic class, and ability. And like I indicated in the short slide that I said, that all these different inequalities can be exacerbated by climate change, but also interact with each other. So me, as a white woman living in a high-income country, I'm experiencing a lot more privileges than other women around the world are. And that is something that we need to be very aware of whenever we talk about gender. And another thing that's really important as well is that gender is not synonymous to woman. When we talk about gender equality in climate change and in general, I think it's important that we also talk about men and it's important to talk about non-binary people. And Laura probably has a lot more to say about that as well. But then coming back to the actual impacts, when we're looking at all genders, we know that they all have different ways of adaptive capacity. We know that they have different vulnerabilities. And we know in general that because of the gendered roles that women have, that globally women and girls suffer more from climate risk compared to more boys and men. And this is mostly because we see, for example, that women have less ownership of land and resources to protect them, for example, post-disaster, but they have also less control of incomes. Are traditional that are being used, and they are being exposed to those air pollutants and resulting in cardiovascular disease, for example. And that's combined with specific risks that they may have for pregnancy and exposure to heat and temperatures, puts a lot of women and at increase. And this is then exacerbating by all the different factors that I just mentioned. So for example, women living in poverty and racial inequalities as well. And with all of this, I think it's really important that we realize that the people that have been least responsible for causing climate change are the people that bear the greatest harms, economic harms, health harms, social harms. And we see that as well when we look at gender equality. We often see that the women have a lot smaller footprint than men, regardless whether they are rich or poor. And with that, I think I want to give it over to Laura, who can comment a bit more on the inclusion of men and non-binary people.
Sure. So, yes, I mentioned is it's mainly a question about vulnerabilities, right? And we know that in the societal structures that we have, women oftentimes are more vulnerable than men are, but people that are outside of the gender system that we traditionally use are those that are especially vulnerable and that are very often really living on the margins of society already, depending on the culture and depending on the society. So those are especially vulnerable, we can imagine. However, it is very hard to say because we have those that data gaps. We basically don't know, like we have data gaps already for the impacts on men and on women. So even there, it's very hard to actually put that in numbers. And for people that are outside this binary categories is even worse. So what we do is like we try to transfer knowledge also from other areas and yeah, see how it helps us. But we're really missing this data, and it is a problem because what we don't know, we can't solve and we can't protect. So we don't know, neither for women nor for men, we know good enough where the actual vulnerabilities and where the actual problems lie. So it makes it harder for us to form policies and to form systems that can actually protect and prevent the impacts of climate change.
Yes, that is very true. So you all mentioned that there are obviously differences between the global north and the global south, and it is sometimes argued that we have achieved gender equality in the Western world. How true do you think this is in regards to climate change issues? Do you think this idea makes us complacent in advocating for climate and gender equality?
Well, I mean, it's factually not true that any country in the world has achieved gender equality yet. There are several analyses, for example, done by the World Economic Forum that show in their Global Gender Gap Index that there's no country in the world yet that has achieved gender equality. And they even estimate that it's going to take us at least 99.5 years before we're reaching gender parity. And I think that's also something that we can see in general when we are looking at the world, because at this moment, there are only 29 countries in the entire world that have a woman head of state. There are only 7 countries in the entire world that have equal legal working rights for men and women. And if we look at history as well, there are only 87 countries in total that ever had a woman in their leadership position. So I would argue in general that gender equality is far away for all countries in the world. Some countries may be a bit closer, and that it is the same thing for climate change as well. So my short answer is no as well. And when we look at climate change, I think we can see that specifically in different things as well. And part of that is in climate change decision making. So international decision making, like Laura mentioned before, like Nicole mentioned before. But what we see is that women and indigenous groups as well have to lobby for decades to ensure that their realities are reflected in international agreements. And we still see now that only 37% of the participants at international climate negotiations, like the Conference of the Parties, only 37% are women, which is a very big historical balance that is still limiting women's access to political spaces and to contribute, which is exacerbating inequalities as well. And this is important specifically because there's a lot of evidence that has shown that women's empowerment and advancing gender equality delivers results across food and economic security and health, but it also has an environmental friendly impact on decision making. And next to that, I think that we in general, wherever you live, if you live in a high income country or in a low income country, you see that post-disaster women are being more impacted. Even if you live in a high income country, your job will also be more affected as a woman compared to a man. You will experience more food insecurity because women are generally lower on the food hierarchy scales, etc. So I think there's still a lot of inequalities. And I think the people that say that we have achieved gender equality in the Western world are always talking a bit from this high horse. And I don't think there is anything true about that.
Yeah, maybe to add on that, it's just that something that Kim mentioned is harder for women to contribute. And it's harder to contribute also because the women that are in that space have to fight to be able to contribute. And a lot of the energy and a lot of the time actually goes into this. If you have to always ask and you have to bring your own data to say, oh, women might be disadvantaged, female voices might be heard in the same way. This is also time and energy that could be used for other things to actually like contribute to the solutions and things like that. So there is, we experience a loss there that is not only a loss for women, that is a loss for the whole climate movement and the society in the end, right? And I think it's very important at this point to make clear that a gender unequal climate change decision making that we see right now is not only harming women, it's really harming all of us. It's harming men in the same way, and that's why actually men also should step up a bit more and advocating for gender equality basically in the decision making, but on every level from local to international.
Yeah, if I could just say one thing, and I think Kim and Laura brought a lot of this data, then we need more data for really understand these differences that we're talking about and the impact. But it's all what I find fascinating is that you can go, and if you're circulating different circles of power, right? If you talk about business, if you talk about medical industry, if you talk about, could be any industry or any sector, the problem is the same. So is the systemic, and which is much more connected to our social norms and this culture aspect, which is very hard to measure. Because one challenge that I see when I go to these discussions and we're talking about gender is that in the end, what we really needs to change is the culture around this perception of women in society. What are the roles that, and it's the same, I think that's why the pandemic is fascinating, for putting on our faces so clearly and so tragically how women are being exposed to this risk so clearly, even though the data shows that men are more exposed to the virus, right? They're more at risk in terms of mortality. And so at the beginning, you would say, oh, men are more exposed to COVID. It's a problem. They are at a disadvantage. But when you put into context and see who is taking care of the sick people during this more than a year now that we are closed in our homes, who is really on the front lines, who is trying to make a difference. And if you see in terms of the political leadership, it was very interesting to start this conversation about how countries who, that were led by women had at least a better response to COVID. Initially, I think these things changed. For example, in Germany, there is a discussion that Laura can also discuss that. But it was a very interesting debate to see. And I think we cannot just go in there and say, oh, women are better leaders, right? But there is always this thing, are the societies electing these women better, or are women better leaders? That's a conversation that it's very interesting that we cannot forget.
Great, thank you all. That's so insightful, and you make a very good point about perception and how we have to put the energy in to change that perception of the evidence that is there. So Laura, alongside also being involved with Women Leaders for Planetary Health, you sit on the board of the German Climate Change and Health Alliance. Could you tell us a little bit more about the work you do there and how gender issues are addressed in the climate and health sector?
Sure. So the German Climate Change and Health Alliance is has, I think, two different main areas. One is really to raise the awareness for the health impacts of climate change. I think nowadays we talk a bit more about that, but it's actually a very recent development. Like until 3-4 years ago, that wasn't a topic at all. When we talked about climate change, we talked about environmental changes, we talked about the Arctic, about polar bears, and we very rarely talked about humans. So the Alliance was founded with that in mind, and really starting to make it a health topic, and to make it a topic that that doctors are aware about, that nurses are aware about, also with the perspective that it's really going to shape our work in the health sector in the coming years and decades. And then the second point that we're working on, obviously, is also the responsibility of the healthcare sector. When we think about sustainable and green healthcare sectors, and also obviously the contributions in emissions that are coming from the healthcare sector, how to reduce that. So we're working with medical association, medical student association, the government on many different levels to get those topics included, working also with the Landslide Countdown on climate change and health, making our own policy recommendations for Germany, and also having this huge education part really where we try to improve curriculums at any level, starting from medical school, but also continuous education, and trying to include climate change and health aspects into there. And that is actually also my main work. But I think what is also very clear is that the gender aspects, they are slowly coming into the work, but more at the margin. They are not really at the center of the climate change and health movement at the moment, I would say. And this is not only for Germany, but that is internationally, really. If you want, both gender and health were kind of non-centered topic in the climate change debate, and they are both, well, started to gain importance at the same time, but independently from each other. As I said before, when I went with the climate change and gender constituency, there were no mentioning of health at all. And on the other side, if you're like looking at the climate change and health movement, there is not much mentioning of gender. And it seems as this like intersection is not really made yet. I think a really good example for this as well is that right now we are working on the German medical school curriculum. And there is one group working on health and gender issues and one group working on climate and health issues, and they are happening at the same time. So it's literally impossible to be part of the same group or to have like any link between them. So yeah, I think for now there is really a lot to do. And I think at this point, I'm then giving it over to Nicole, who at least offers one solution to that with women leaders for planetary health.
All right, so I'm assuming I want to now present a little bit about the women leaders of planetary health. And let's start with the question. I think what you're saying, Laura, I mean, there are many people here listening to us who want to solve climate, right? I think we all want to solve the climate problem. I think we all want to be healthier and have a healthy population. And we all like and protect equality. And we are very worried about diversity. Like I said, it's not only about women. It's about ending the systemic barriers of development, right? Of a sustainable development. So I founded the Women Leaders of Planetary Health out of necessity, because I'm also a bit tired of these divisions, as if you're in this group and then you're in that group, and then if just for obvious reasons, if you're a system thinker, if you're really interested in change, you cannot put this into little boxes and divide your thinking. Of course we do. It's a natural thing that we have to, because it's impossible for a human being to think at the same time about everything. But if you want to be serious about solutions you're proposing, you have to have at least the intention of bringing these topics together. So when I was in Rwanda in 2019, and it's fantastic to have now be the founder of Women Leaders of Planetary Health, because this year everybody talks about planetary health. But 1 year ago, it sounded almost like a joke, like, who is this person trying to fund? This is a very, is it trying to, dealing with horoscope or something, this planetary health? So I just saw very recently Christiana Figueres, who is the former, of course, executive secretary of UNFCCC, who did an amazing job, is an amazing person, talking about planetary health. And this is coming from the climate community, which also we know how different these things were. So when I was in a meeting about leaders in global health, I realized, and I'm not a medical student, doctor, or professional, and I'm not a gender advocate. I wasn't, but now I have to bring these communities together, because they were not seeing these connections. And that's how inspired I was. And I said, we got a very group, and at IASS, the institute that I work in Germany, also gave me a lot of opportunities to found something. We are now an organization advocating for these connections, for seeing gender in the context of planetary health. We launched a mentorship program, but we want to focus in the global south, which is another thing that we see missing a lot. We see this conversation of during the pandemic, we are complaining about lockdown, but we all, I don't know, maybe doing parties at Instagram and virtual gatherings. But if you are living in, I don't know, Bangladesh, India, Brazil, in a slum where I am from, you don't have the water to wash your hands. So we really selected people through this mentorship that they would give us not only the technical knowledge about planetary health, but also this skills, the softer skills that we call. We're talking about negotiation. We're talking about how do you position yourself, about networking, about storytelling, about your values even. How do you see yourself? What kind of role you want to have? Not everybody needs to be the next president, right? We need to understand your own role in making this change. So we also have, let's say, 3 things that we want to focus with this organization is that we have the mentorship program that is coupled with a digital academy that to tackle these issues that I've just discussed. And every year we want to also have this annual summit. We had a virtual summit last year in December with very interesting names and also a lot of men engaged in this transformation, because we're not going to get to this creating another club of women to discuss disparities. So we are seeing a large growth. We have 20 countries represented from low and middle income countries in this mentorship. And I would invite you to connect with us because we are going to launch a second round of mentorship probably end of April. We're going to discuss that, and that will take place on the second semester. So stay tuned for more information and activities. We also do a lot of public events like this, because it's the beauty of the pandemic is that we can have a lot of reach and talk to people that before would require a lot of carbon emission to be together. So this is one thing. Thank you.
That sounds great. So we're talking about these opportunities of creating change. I was wondering if any of you think there are any policies globally that have had a positive impact on the climate change and gender issues we're talking about today?
Yeah, I can comment on that. So I firstly want to split the question a bit in two and start with talking about why it is so important that we talk about gender in climate policy specifically as well. So when we're talking about gender mainstreaming, and that is what most of us in the gender space are advocating for, we're talking about incorporating a gender perspective into any action, policy, or legislation to ensure that gender concerns are addressed and that they are not exacerbating or perpetuating already existing inequalities. And it is really important because, like we've already discussed, women are impacted differently. They have different exposures, different susceptibility, and different ability to cope with hazards, like non-binary people have, like people with intersecting forms of oppression have. And to give an example of how wrong this could be, imagine that you are designing a carbon tax and you do it in a way that you're not incorporating this gender lens. And you're increasing the cost of carbon-intensive essential goods and services, for example, electricity and heating. This can disproportionately affect low-income households, and these are often characterized by women. So as a result, you will be exacerbating this inequality between the genders because you are not taking into account that women may be impacted more by these carbon taxes. Likewise, sometimes we see that carbon taxes are being designed with measures that have income taxes. And as a result, this often has a benefit for men, but not necessarily for women, because women are a bigger part of the informal sector, have less, get less paid for their jobs, etc. So this is just an example of why it is so important that we take this gender lens in policies. And then when we look at the international and global network of policies, the UNFCCC has been annoyingly gender blind, actually. And it's only since COP20, when the Lima Working Program was established, that we really saw changes in that. Before that, there were some policies, but they were mostly only focused on gender representation, rather than that they really included this gender lens to adaptation and mitigation. But this Lima program was established as a 2-year working program that really wanted to promote the gender balance and achieve gender responsive climate policy by encouraging all parties and relevant organizations to support, for example, raising awareness and trainings, etc. And this has then been further extended in COP22 and COP25. So the last COP, we just had a new version of this program together with the Gender Action Plan. And this is an enhanced action plan that is now providing the opportunity to meaningfully shift from capacity building to enhanced implementation of all these gender responsive climate action at all levels, including, for example, gender responsive technology, and more really the implementation, as well that we finally see that there is more focus on the inclusion of indigenous knowledge and traditional knowledge, which is something that has been excluded for so long. And especially women in indigenous populations, they have so much information and knowledge about nature that we are not using. So I think that this has been a really big change in international climate policy that will have a huge impact on gender equality as well. That doesn't mean that there is nothing, that we don't have to do anything anymore at this moment, because we still need to progress further and we still need to make sure that this is actually implemented. And we still need to make sure that we actually make sure that we progress towards the Paris Agreement. But I personally see that as a big step forward for gender equality.
Great, thank you. We're slowly running out of time, but what do you think in the future would be the expected trajectory of gender inequalities due to climate change, and what you think the future will look like? Laura?
I think there is two things about it. So first of all, we have to be realistic. The task that we're having lying in front of us is a huge one. And we have very little time left. I think that is very obvious now. We are actually in the middle of the crisis already. So realistically, we have to get on it today, not tomorrow. And we have to use all experience and all solution making that we can get. If we start by excluding women, if we start excluding indigenous people, the global south, whoever, we won't be successful. We really need everyone on board. But on the optimistic side, I think we see improvements, and Kim had just laid it out very nicely with the Lima Working Program, and there's more and more mentions of gender and health in the NDCs. We see more women and more people with various backgrounds participating in decision making, even so it's a slow improvement. There is improvement. What we really see is a climate movement led by women, especially young women and women from the global south. And I think this has been a very visible change that we are all aware of. Like right now, the face of climate movements are young women. And I think that really contributes to the fact that we can't ignore those voices anymore. And I think this is not enough yet, but it's moving into the right direction. And I think it's just very important to always keep in mind that health and climate justice and gender equality are very closely connected. So we won't achieve the one without the other. So ending this on the optimist note, I think we can do it. We can fight climate change and increase gender equality, and those are actually not two separate processes, but it's one and the same. We can't solve one without the other, and I think this now has, this information has now arrived on the top stages, and we have to really implement that and move forward with that.
Yes, definitely.
So,
okay.
Let me just also
please jump in.
Just because it's, I think, as you say, it's going to be a massive task, but we are, and you are the generation who can make a difference into seeing this in a systemic way. And it's so encouraging to see how the discourse, the speech at all levels is changing a little bit. And we need to start with words, right? Words matter, and just changing, for example, even in the case of the United States, right? Having a president who recognizes climate change and who wants to make a difference. Of course, it's not going to change, next day, because it's immense of all the vested interest that we have behind this question. So it's very important, but I was very encouraged today to see, for example, companies talking about planetary health. I was in an event this afternoon with pharmaceuticals discussing planetary health. They're starting to realize that they cannot also appoint someone that will do climate in the corner of a big company, and if they don't see this in a systemic way, probably, of course, we're not going to have results. So I think it is encouraging to see these differences, and we are in the right moment to make those contributions. And that's why it's so exciting to be in events like this one. I always get really happy to talk to whatever youth movement that we have, because they are the ones who can understand. And another thing I want to highlight is, although we talk a lot about the UNFCCC, and I work with the United Nations a lot, I've been attending COPs for the last decade. I remember sleeping on a couch during the 2009 meeting in Copenhagen, as if you know the history was this called as the tragedy of the meeting. But we see how this is transforming, but a lot of this change will be outside the United Nations, right? It's really on the local level. Like I said, we need to engage these other communities, business, need to also make a change. So, and society needs to put pressure, because activism is very important. But if you also don't start seeing what's about your own footprint, about what are you doing in your own community, because we cannot just only complain, right? We need to make a difference and be coherent with the things that we are trying to advocate. So that's my point. Thank you.
Great. Any other comments from anyone? No? Excellent. And that leads me on to my next question, which is, are there any choices we can make as individuals to combat the issues we have discussed here today?
Maybe I should, can I jump in on very quickly? I think we touched a lot of this, what can be done, right? And I really like this idea that we need to cross-fertilize ideas. That's my number one call. Get out of your box and see, and if you try to understand the language even of other communities, right? What and where the challenge of the other people, why they're not, because if you're always talking to people inside, if you're always going to this global health movement studies, you see there's no problem there. Everybody agrees that you need to tackle climate change, and everybody agrees that gender is a problem, gender inequity. So if you circulate outside your own comfort zone, if you like dance with strangers, I think that's a very nice thing you can do for your own intelligence and for your own work. Very important, and especially also try to connect to networks, right? I think we never believe in your ability to drive change as an individual. And of course, Greta is the biggest symbol that one little person can start a movement. But we need to see all the other people who cannot just, a lot of countries, people don't even have free speech, so they cannot do activism in these countries. So put yourself in the position of this, in the global south is very important, and men need to get involved in this movement. And if they can, if they understand their role as change makers, that's going to be a very beautiful revolution. And I'm seeing a lot of colleagues who also are so excited about Women Leaders for Planetary Health, for example, just because they realize the importance and how everybody is affected. So I think invitation to all men and women here listening to this today. Thank you.
Yeah, adding on to this, I think when we talk about individual choices, we have to be a bit careful, because I think for a very long time, this talking about individual choices, especially when it comes to climate change, has also been used a bit as a distraction by governments, right? Because if everyone changes their individual lifestyles, it still doesn't get us anywhere if we keep everything else in the system as it is, and if we keep the power as it is right now. So individual choices can always only be one part. However, there can be very strong individual choices. The individual choice to vote, for example, the individual choice to be vocal about why we need that, what we're doing here. So climate activism and gender activism, and thinking it both together. Recognizing our own privileges when we speak, in whatever we are doing, because that's what it is, right? We're sitting in the UK, we're sitting in Germany, we are probably least affected by climate change. We still complain when there is a heat wave, but it's just an annoyance. It's not threatening our livelihood. It's not threatening our health in the same level as it is doing somewhere else. It actually is impacting our health. We just don't see it that much, because we also for a long time didn't look at it at all. But we're very good. We're doing fine. But just because we are doing very fine in Western Europe doesn't mean everyone is doing fine. So we have to really recognize that. And I think we can't talk about climate change anymore without talking about climate justice and without talking about gender justice. And I think this is a choice that we can make.
Yeah, I can only add very little to that, because I fully agree what both Nicole and Laura have been saying. I agree that we should be reaching out to further than our own bubbles, that we need system change on top as that we need individual change. Like Laura already indicated, it is something that is often a bit used as an excuse by government to not take action. Like we also see with, for example, the food industry and how we deal with individual choices of obesity, for example. But like Laura also said, I think for me, it is really important that we recognize that there are inequalities and what our own privileges are and what our own roles are in these inequalities. And that we really use our privilege as well to amplify voices of those women who have less privileges and of those groups that have less privileges. And really try to work towards reducing those systems of oppression and making sure that we have everyone in the playing field and that can share their voices that needs to be there. And of course, like Laura said as well, there are things that you can do very simply as well, like voting, like rejecting sexist and racist attitudes and things like that, but as well being involved in activism. And with that, I had a really weird experience myself a few years ago where I was really getting frustrated when Trump was just rising to power and they were stepping out of the Paris Agreement. So I had set up a Facebook group to organize a march. And then suddenly I stood in front of 8,000 people just because I took the initiative to reach out to people. So I think it's really, really powerful to take that initiative and to try to find people that are like-minded, to try to find people that are not necessarily like-minded, and to bring them together to talk about these issues. Because together we can make these changes, even though the government may be a bit later than us as society, we can make the start of that, and then the governments can even follow. And I think that is what I wanted to say.
Okay, thank you all very much. We've had a few questions from the audience as well. Some of them have been answered, but one question is if you all believe in targets or quotes for gender parity, gender equality. I was wondering what your ideas were on that.
I feel that Laura and I probably have a lot of opinions about it as well, because in Women in Global Health, there's often this advocacy for gender parity and for the use of quotas, right? And I do think that there is certainly a space for that, but I am afraid that if we focus too much on quotas, that we then lose part of the bigger picture, which is system change. We need to make sure that we get rid of the barriers that prevent women from entering those spaces. And quotas can be helpful at the first instance, but system change needs to be the main goal. And I think that is something often that we forget when we talk about quotas. And I'm sure Nicole has a lot to say about that too.
No, I find it, and I agree with what you just said. And it's not an easy debate, right? It's because, and it's a long one. I actually myself have been thinking about this for a long time, and this links to Brazil and quotas for students of lower backgrounds, or I think that at the beginning, and there are some studies showing that, right, that it's very important to give this first opportunity, because these barriers are here, they exist. So if you don't break them and don't give this first step, how do you want to tell them to achieve all these things and saying that the opportunities are not equal? So, but I also think that if we keep, it's not only about the quotas, this cannot be our main goal and as a policy, because, and as you know, the parity itself doesn't solve the problem, because when you see the real challenge there is when you have many women driving the process, but then the decision maker, then those last 10%, it's not a decision made by women, for example. And you never, if you don't have women at the top who can lift the others to these positions as well, it creates a problem. So the quotas, I think they work in a specific case. There are studies showing that. However, I would be cautious in the long term, because I don't find them as the perfect solution.
Yeah, I agree that quotas are or can only be one part of the puzzle, especially since we often discuss about quotas on a leadership level. But the barriers often, they come much earlier than at the leadership level, right? So then the quotas also have to start earlier, or other mechanisms. And as Kim said, like the system has to change, and like not only on the leadership level, but from the foundation actually. And I think another important point when we consider that is also that the discussion about quotas, at least in some societies, has become very toxic. And it seems like it's more used as a distraction. It's not actually getting us anywhere anymore. And I think there can be more effective ways to achieve gender equality than keep this discussion on gender quotas up without getting anywhere.
Just a very small mention that I think is very important when we talk about quotas as well, is that most of the time they're excluding people that are non-binary or identifying as any other gender, because we often talk only about men and women in quotas. And I think that's very toxic, especially in a society as we are in now, where we're actually recognizing that gender is a spectrum and not just binary.
Right, any other comments from anyone? Great, in which case I think we will start wrapping up. I will just share these socials at the end. Thank you all for joining us for this webinar, and thank you to our 3 amazing speakers. The recording will be uploaded to YouTube, I believe, and please show your support by following and getting involved if possible. Next week, we will have our last webinar of the series, which will be What is COP26, an introduction and how to get involved. So thank you all for coming, and we will wrap this up here. Thank you.
Thank you everyone for the invitation and for the amazing work you're doing.
Thank you.
Happy to be in touch.